Good morning. Today we are going to cover one of the important chapters in public health industry, that is dental manpower. So we'll just introduce what is currently happening in dental manpower in India. So we'll give an introduction on that. Some statistics. After that, we'll go to the different types of dental manpower or different types of people or professionals who can help dentist. So coming to dental auxiliaries, that term is called as dental auxiliaries, but I would like to introduce it as a dental manpower force in India. So condense our introduction and changing trends in dental manpower since 1920, then definitions, classification, non-operating auxiliaries, operating auxiliaries, expanded function dental auxiliaries, then frontier auxiliaries and new types of dental auxiliaries. So first portion will be a little bit statistics, then we'll come to this auxiliaries or ancillaries or the person who can help the dentist in doing his work. So in different countries, they are having different names and different jobs concerning to dentistry. So coming to introduction, India has a diverse ethnic, linguistic, geographic, religious, and demographic features. It is the second most populous country in the world. To serve the oral health needs of this massive population, India has geared up its dental education infrastructure. At present, India has the greatest number of dental colleges in the world. Excuse me. Its healthcare delivery system consists of both public and private healthcare setups. In India, over the last 25 years, the dental workforce has grown in the absence of any specific design or policy planning, resulting in an oversupply of dentists. At present, there is neither dental workforce planning at state or national level, nor coordination between the Dental Council of India, which is a regulatory body in India, and the Departments of Health and Human Resource for dental manpower. Coming to changing trends in dental manpower since 1920, we all know that there is a boom in dental colleges. So did the dental professionals in India, especially in the last 2 decades, especially after 2000. So we'll be discussing that under the following headings: trends in government and private sector share, trends in growth of dental colleges, available positions in students, trends in growth of registered dentists, and dentist to population ratio. The reference is from Jaiswal et al. So trends in government and private sector share. So this is a graph, proportional bar graph, which is showing this particular trend. In 1920, there was 100% the dental graduates are passed out from government dental colleges. That means there is no private dental college at that time. That is pre-independence era. So we can't expect a private association working in that particular time. Coming to 1950, also the situation was almost same. There was 100% government contribution. Then in 1970, there was 93% contribution from private government sector, only 7% from the government sector. And coming to 1980 and 1990, it was 77 and 44% government sector respectively. There is a drastic change in this 10 years. And from there, it comes to again half, that is 22% in 2000. Then it decreased further in 2005 and 2014. So this was a trend in dental colleges, in private and government dental colleges in India. So there was 301 dental colleges according to 2014. After that, I don't think much dental colleges are given approval after 2014. So it will be same still. So there was 301 dental colleges. Out of that, 86.404% were are private dental colleges. And BDS positions in that is 25,270. Out of that, 90% is shared by private sector. And MDS position also 88.46%. So trends in growth of dental colleges. After 1973, there was a drastic increase. But from there again, if you notice after 2000, you can see an increase of double. Like if it was 145, when coming to 2014, it was 300. So from 2002 to 2014, that means in 12 years, there was a doubling of the dental colleges. Previously, from 50 years, there was only 145. But from 2000 to 2014, it became 2002 to 2014, it became another 150. Then available positions in students are total seats for students to enter dentistry is 25,270. Total colleges are 301. Out of it, PG courses 2005 colleges have 205 colleges have PG courses. PG diploma courses is carried out in 9 dental colleges, that is total 39 seats. Then paradental courses in 68 dental colleges, that is 1,186 dental mechanics and 883 dental hygienist training. Out of it, the distribution of this MDS courses is prosthodontics having the maximum number of seats, that is 720. That's almost 14.35%, followed by endodontics 13.90. Then comes orthodontics, almost 13. Even perio is almost 13%. And coming to oral surgery and periodontics, it was 11 and 10% respectively. And the least we are having is public will dentistry. So trends in growth of registered dentist. Here also after 2000, you can see 2002, the course is starting means another 5 years they're going to pass out. So in 2007 onwards, you can see a drastic increase, almost again doubling the number of registered dentists. It's proportional to the dental colleges starting. So dentist population ratio in 2014, it is 1:1000, 10,000 almost. In 1960, it was 1:3 lakhs. Again, there was a geographical distribution mismatch in dental colleges. So did the dental students also. So in Delhi, Karnataka, Goa, Maharashtra, Kerala, Tamil Nadu, Punjab, and Chandigarh, the dentist population ratio is 1:2000 and to 1:5000. So it's very much less number of people compared to a dentist. So for every 2000 people, we are having one dentist according to the data, but how many are practicing, that is a different story altogether. In other states, it is 1:10,000 and 1:25,000. Again, in rural urban variation, it is there. That is in rural, it is 1:30,000 and urban, it is 1:4,000. Coming to this map, these are the MDS college and BDS colleges. When we go to the dark blue shades in this map, there are more number of dental colleges, and when you're coming to the light blue shades, there is fewer number of dental colleges. And when coming to the red color, there is no dental colleges at all, especially in northeastern states. Here we can see the more dental colleges are in South India, especially in Karnataka. There are almost 42 dental colleges, if I'm not wrong. And in Tamil Nadu, you have another 32. So more of dental colleges are concentrated in South India. In North India, it is comparatively less. So this is all about the distribution of workforce or distribution of the dental colleges in India. I just want to give a gist of that portion before starting with the dental manpower, what we are having in India or all over the world. So coming to definitions, I said, what you are going to define a dentist. So a dentist is a person licensed to practice dentistry under the law of appropriate state, province, territory, or nation. That's all. So dental auxiliary means a dental ancillary is a person who is given responsibility by a dentist so that he or she can help the dentist render dental care, but who is not himself or herself qualified with a dental degree. Classification at a conference conducted by WHO in New Delhi in 1967, the following classification was suggested. That is non-operating auxiliaries. It is clinical, laboratory, again classified into, then comes operating auxiliaries. Non-operating auxiliaries are clinical auxiliary. In that clinical auxiliary is a person who assists the professional in his clinical work but does not carry out any independent procedure in the oral cavity. The laboratory auxiliary is a person who assists the professional by carrying out certain technical laboratory procedure. The operating auxiliary is a person who, not being a professional, is permitted to carry out certain treatment procedures in the mouth under the direction and supervision of a professional. This was basic classification given first. Then again it's revised for easy noticing of that this auxiliaries. That is non-operating and operating auxiliaries. Under non-operating auxiliary are dental surgery assistant, dental secretary, dental laboratory technician, dental health educator. These people are not going to touch the patient. That is the difference in sense. They are not going to check in oral cavity or do any procedure in the oral cavity. They will be doing completely outside the oral cavity or in the reception or in the near the dental chair or any other laboratory works, but they are not permitted to touch the patient. So coming to operating auxiliaries, these are the person who can touch the patient or can do some procedure to the patient. They are school dental nurse, dental therapist, dental hygienist, expanded function dental ancillaries. So dental surgery assistant is a person who assists the dentist with his clinical work but does not independently carry out any procedure in mouth. Their functions are smooth running of the clinic area, management of instruments, equipments, and materials, including cleaning, sterilizing, and recycling, supplies instruments to the dentist chair side as needed. So every clinic will be having a dental surgery assistant, otherwise it will be difficult to manage a clinic. So there has a duty to look after the general well-being of the patient. Patient reception and appointment making duties and clerical will be doing by this particular group of people. In Klein in 1944 showed that addition of dental surgery assistant with dental practice was associated with 33% increase in number of patients treated. Obviously, if a person is there to help you, your time is going to save. And they raised a new concept called as four-handed dentistry. Yeah, this is what is four-handed dentistry. Patient is positioned and the doctor is going to sit on the right side if the doctor is a right-handed person, and the assistant is going to be on the left side of the patient. So she can hold the suction and she can pass the instruments and she can show the x-rays and she can give any materials which is mixed to the doctor, and he can easily placed. So almost 4 hands are working on a particular patient, which will save a lot of time. So if a patient is seated like this and doctor and assistant is placed in this particular position, you are going to get an operating area, a static area, which is behind the head of the patient, and a transfer zone, which the instruments are transferred from the left side to the right side of the patient. You are not supposed to pass the materials or any sharp instruments or any other chemical substance in front of the face. So coming to dental secretary or receptionist, the person who assists the dentist with his secretarial work and patient reception duties. Sometimes these both works are doing by one person in clinics in India particularly. And dental laboratory technician is a non-operating auxiliary who fulfills the prescription provided by dentist regarding the extraoral constructions and repair of oral appliances and bridge work. He undertakes many mechanical tasks like casting of models from impression made by dentists, include the fabrication of dentures, splints, orthodontic appliance, inlays, crowns, and sundry items such as special trays for the topical application of fluoride agents on teeth. Denturist. During the late 1970s and early 1980s, some dental laboratory technicians tried to change the State Dental Practice Acts to allow them to treat public directly for fabrication of dentures. These technicians call themselves denturists and their occupation is called as denturism. By mid-1990s, denturists were legally recognized in most Canadian provinces and few states in US. The ADA defines denturism as fitting and dispensing of dentures illegally to public. Several countries have allowed laboratory technicians to work directly with the public. Tasmania in Australia, Denmark, and in Maine, the technicians are allowed to dispense dentures with or without the supervision of a dentist. Some countries have supported the denturism process and some has opposed. Dental health educator is a person who instructs in the prevention of dental disease and may also be permitted to apply preventive agents intraorally. In few countries, the duties of some dental surgery assistants have been extended to allow them to carry out certain preventive procedures. Operating ancillaries. The school dental nurse, New Zealand type school dental nurse, they are called as, because it first started in New Zealand. So this was established in New Zealand in 1923 to deal with a large amount of dental disease present among the school children. The government made a provision for training young women as school dental nurses who would provide the bulk of the treatment in school dental services. The duties are examination of the children and the diagnosis and treatment of most prevalent dental diseases. She can prepare cavity and restore teeth with amalgam and silicate cement, extract deciduous teeth, scales and polish teeth, applies topical fluoride solutions, provides dental health education, and refers more complex cases to dentists in the area. So when we are going to appoint a school dental nurse in a school, they can do most of the procedures, and for invasive procedures, they can refer the patient to the nearby dental clinic or dental college. She is permitted to use local infiltration anesthesia, but not block anesthesia. Each school dental nurse is assigned to a school where she is employed by the government to provide regular dental care for 450 to 700 children. So it is going to improve the standard of living or quality of oral health. And dental therapist is a person who is permitted to carry out to the prescription of a supervising dentist certain specified preventive and treatment measures, including the preparation of cavities and restoration of teeth. They are like the New Zealand type dental nurses, but their role is quite different as they are not permitted to diagnose and plan dental care. Also known as New Cross Auxiliaries because it started first in New Cross area, London. So that's why the name is given as New Cross Auxiliaries. They can do some clinical caries diagnosis. Caries can be diagnosed, but not other pathology. So cavity preparation, deciduous and permanent dentition can be done. Then vital pulpotomies under rubber dam placement and extraction of deciduous teeth can be done. The dental hygienist. This type of ancillary was first employed in 1906 in USA, and in 1913, the first formal training was established. So duties of a dental hygienist is scaling and polishing of teeth, topical application of fluoride gel, then provision of dental health education. In some countries, they are permitted to take radiographs, make impression for study models, and polish restorations. The first father of dental hygiene was Alfred Civilian Fons, and he trained Irene Newman, which was the first dental hygienist. Then comes to expanded function dental auxiliaries, also known as expanded function dental hygienist or expanded function dental assistant or expanded function auxiliaries and expanded duty dental auxiliaries. These are the different names they are called in. And an EFDA is a dental assistant who has received further training in duties related to direct treatment of patients, though still working under supervision of a dentist. They are basically dental assistant. That means the first classification which I have seen, is non-operating auxiliaries, but by giving them certain training, they can be given the patient. So previously in our country, there was a provision for that. When a assistant is trained enough, they are used to give certificates as a B grade dentist. So now it's not legal. ID and DCA has opposed it drastically. So they undertake reversible procedures which could be either corrected or redone without undue harm to the patient's health. They do not prepare cavities or make decision as to pulp protection after caries has been excavated, but work under side of the dentist. They do only the restorative procedures. The functions are placing and removing the rubber dams, placing and removing temporary restorations, the matrix bands, placing of acrylic restoration in previously prepared teeth, condensing and carving amalgam restoration in previously prepared teeth, applying the final finish and polish to previously listed restoration. Then coming to the dental hygienist with expanded duties, they can remove sutures, placing, finishing and polishing restoration of amalgam and resin, placing and removing matrix bands, placing temporary fillings cavity liners, retracting gingiva for impression taking, fitting and removing of orthodontic bands, separating of teeth prior to banding by a dentist, and cementing temporary crowns. Almost all procedures in the clinics not invasive can be done by this dental hygienist with expanded duties. Then comes to the frontier auxiliaries. In developed countries, dentists remain in urban centers and the number of areas too distant from public or private dental offices for the inhabitants to receive regular comprehensive care or emergency pain relief is very large. That we have seen already in India also the same situation. There is a mismatch in the distribution of dentists in rural and urban areas. Nurses and former dental assistants can in such areas provide valuable service with minimum training. Simple dental prophylaxis, basic dental education, dental first aid can be rendered in these cases. With pain and patients can be referred to nearest dentist. Then comes new auxiliary types. The expert committee on auxiliary dental person of the WHO has suggested two new types of dental auxiliaries. They are dental licentiate and dental aid. The dental licentiate are semi-independent operators. Their functions are prophylaxis, cavity preparation and filling of primary and permanent teeth, extraction under local anesthesia, drainage of dental abscesses, then early recognitions of more serious conditions. It comes to the dental aid. The duties include elementary first aid procedures for the release of pain, including extraction of teeth under LA, control of hemorrhage, and the patient can be referred to the nearest center. So these are the basic functional structure of the para dental professionals. So in India, in the current situation, we have enough and more dentists for practice or give dental care to the patient. The only area which is not established is the government sector. More and more dentists has to be taken up by the government, especially in rural areas, in primary health center and community health centers. Other than the dental auxiliaries or other dental kind of this New Zealand type of dental nurses are not actually needed in the current scenario in India, because we have a good population dentist population ratio, which is given already by the WHO. So we have a good dental force. The only thing is the proper dental manpower planning should be done. So this is one of the important chapters. So we are going to get a essay from this chapter as dental auxiliaries, and New Zealand dental nurse as short notes, denturism as short notes. Then you can get expanded function dental auxiliaries as a short notes also. So this is one of the important chapter in public health dentistry. So hope you understand this particular chapter. Thank you.